In chronic inflammation, this is a long-term immune response to a stressor. And this can ultimately, instead of causing healing, can actually cause damage to healthy tissue. And so there's lots of different causes to chronic inflammation. Those can be infections that, maybe started out as an acute infection, but kept kind of going on, or you kept developing chronic infections. There can be inherited risk factors that predispose you to having chronic inflammation. You can have an abnormal immune response to something. So, in the case of autoimmune diseases, your immune system is having an abnormal response to a normal component of your own body. It can be due to excess weight or obesity or different lifestyle choices like diet, stress, and poor sleep. And what can result with, as a result of that chronic inflammation, can be things like autoimmune disease, cardiovascular disease, diabetes, and of course, what we're going to be talking about and what we worry about is cancer. Now, this concept of inflammation and cancer has been around for many, 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 many years. It goes as far as back as the 1800s. German physician and scientist, Dr. Virchow, who gave us a lot of our medical knowledge today, he was the first to actually observe that cancer often developed at sites of chronic inflammation. And today we know that as many as 1 in 5 cancers are believed to be either caused or influenced by inflammation. And so some of these conditions or associations that we know of are things like if you have a history of inflammatory bowel disease, like ulcerative colitis or Crohn's, that can predispose you to an increase your potential for developing things like colorectal cancer. H. pylori, which is an infection that can happen in your stomach, certainly if that goes untreated, we know also can predispose or increase risk for things like stomach cancer. Hepatitis B is associated with liver cancer. HIV is associated with lots of multiple cancers, but certainly lymphoma is one of them. And then things like cigarettes or asbestos exposure long-term can also cause things, lots of different cancers, but particularly lung cancer. And so anything that causes inflammation leads to kind of over replication or excessive replication of DNA. Because you can imagine, if we think back to that picture, there was a lot of activity that's happening. You're trying to clear out that space. So there's a lot of cells that are coming into the area. And so there's a lot of cellular replication that happens. And anytime you're replicating things quickly or in excess, there's always a risk for mistakes or damage that can happen to the DNA. When that happens, you can get production of free radicals, and free radicals in and of itself can cause tissue damage and then further cause DNA damage. And then you get into this loop, which then predisposes you to develop cancers. In chronic inflammation, you also, again, get that cytokine production, which again, cytokines are basically just chemical signals that are part of the inflammatory response that cause other cells, other immune cells to come to that area to kind of work and do what they're supposed to do to kind of help with inflammation. But as part of this, that can cause angiogenesis or development or of new blood vessels. And in part, that's to improve delivery of nutrients and oxygen that the blood supply can bring. But if there is damage to DNA, if there's a formation of, a cancer that's there, as there's more blood vessels, there's more nutrients and oxygen that's being delivered, that's just more fuel or feeding, potentially a tumor base. In multiple myeloma, there's the hypothesis has been made that chronic antigen stimulation or chronic, exposure to something that leads to chronic inflammation or infection may predispose to developing a plasma cell disorder, anywhere from MGUS to multiple myeloma. This ongoing kind of inflammation can cause abnormal immune response and increase the risk of genomic alteration or even genetic instability. Again, that can even, we've seen potentiate the cause from things like MGUS or smoldering to active myeloma. There still has not been any definitive evidence that infections or oncogenic viruses are a direct cause of myeloma. So similar, if we think back to, that the chart that I showed, that H. pylori we know is linked with stomach cancer or hepatitis B and C related to liver cancer. We don't have any kind of direct, again, oncogenic viruses or infections that we know are a direct cause of myeloma.